question what most of them ask is, how do we go when we get a back pain? Now we need to understand that most of these back pains are fatigue back pains that can be very much easily solved by simple exercises, back posture management and simple medicines. So never get worried whenever you have a back pain. Uh, Go to a doctor. If it is not reducing in 10 days time, they will identify the cause of back pain by doing x-rays or sometimes MRI as well. So once your problem is identified, they put you in a medical management regime and physiotherapy. So this is all in all to bring down the pain. The initial attempt is to bring down the pain, and once your pain is less, that is the time where we have to focus more on maintaining a pain-free period. Now this happens by doing regular exercises, by maintaining a good posture. So we should not forget, what happens with most of the patients is once the pain reduces, they forget about it. That is the problem. We should not forget that. Instead, once your pain is less, your maintenance phase begins. So you have to keep doing your exercises, keep focusing on your posture, and that is how you're going to have a long-term pain-free back and pain-free spine. And if you are pain-free, you can work for, you'll be much more productive for your company, will be much more productive for your country as well. Third thing is, how do we treat these back pains? So as I said, initial management, the phase of management is by simple medicines, exercises, posture management. Generally, most of the back pains, I would say 90 to 95% of the back pain would reduce in 10 days to 2 weeks time if taken care well. After 2 weeks, if the pain is still persisting, if the pain is still bothering you, the pain is not coming down with the tablets, you got to visit to the doctor and then evaluate what exactly is happening. Sometimes a surgery is also indicated. Surgery is required only when you develop major or a red flag symptoms, what they call. Now, what is red flag symptoms? Red flag symptoms are when your back pain is associated with any issues with your urine control, as in you're not able to pass urine, or your back pain associated with any kind of fever, weight loss, or your back pain associated with some kind of weakness in your legs, or your back pain is coming after some kind of injury to your body. So these are the things where the back pain should not be taken light, and you should take treatment as early as possible. Now once any particular cause of spine is identified, the treatment is based on that. So for example, if you have a slip disc or the disc has prolapsed, which is causing significant compression on your nerve, you might need a surgery to decompress your nerve, and if there is lack of stability, maybe to stabilize your spine as well. Okay, so there are different types of surgeries which are available depending on the patient personality, depending on the pathology. We offer different surgeries, but to make it simple, the surgery candidates are very few. I would say only 1 to 5% of patients would only go for surgery. Remaining back pains, they get cured with medical management and a good physiotherapy. Thank you.